Did you know that your arteries could be severely obstructed, yet you might not experience any chest pain? This is one of the most alarming realities about heart disease. Its indicators are often so mild that you might not recognize anything is amiss until it could be too late. However, your body frequently sends subtle hints before any severe symptoms occur, and by recognizing these early signs, you might identify a problem soon enough to make a life-saving difference. In this segment, we will examine 5 warning signs that your arteries could be gradually constricting even if you generally feel fine. Many of these symptoms manifest in how you move, how you feel, and how your body copes with routine tasks. Commonly attributed to aging, they might actually be indicators that your heart is not receiving adequate blood supply. Continue watching until the end because I'll not only reveal these warning signs but also explain what is happening inside your body and what measures you can take right away to safeguard your heart. If you've been feeling more fatigued than usual for no reason, more out of breath, or just have an uneasy feeling that something isn't right, even if your doctor hasn't raised concerns, this information is for you. Let's start with the first cautionary sign: shortness of breath even during minor exertion. One of the earliest and frequently overlooked indicators of blocked arteries is experiencing shortness of breath during daily activities. We're not referring to running marathons. This type of breathlessness occurs during calm, ordinary moments like strolling across a parking lot, ascending a few stairs, or bending to tie your shoes. Activities you once did effortlessly now leave you struggling for breath, perhaps causing you to momentarily put your hand on your chest. It's easy to attribute this to aging, but the truth is, such shortness of breath, particularly if it's newly developed or worsening, is your heart signaling that something's wrong. When arteries begin to constrict, blood flow efficiency decreases, meaning less oxygen reaches your heart muscle and the rest of your body, especially during physical exertion. Inside your body, your heart attempts to keep pace, but if the vessels are tight or partially obstructed, it fails to deliver enough blood to satisfy your muscles' needs. This causes your breathing to quicken, your heartbeat to accelerate, and even mild activity to feel overwhelming. You might find yourself halting midway up the stairs or needing a momentary pause after walking up a hill. Initially, you might dismiss it, but eventually, your body adjusts your lifestyle to adapt to these new limitations. Consider Melvin, 76 years old, who mentioned that he used to walk to the nearby store every morning but recently found himself needing to stop halfway. He assumed age was finally catching up with him. However, a quick medical check revealed significant narrowing in 2 of his coronary arteries. A procedure followed by some lifestyle changes allowed Melvin to return to his usual walking routine without difficulty. The danger with shortness of breath is its subtle onset. You don't experience pain or dramatic episodes, just a gradual shift in your capacity and how it feels when you exert yourself. But your body is aware, and, if you pay attention, it's often the initial indication that your arteries might not be as clear as they once were. So, if you notice you're getting breathless doing tasks that previously seemed easy, listen to your body. Do not disregard these signals as mere signs of aging. It's important not to dismiss certain symptoms, particularly when combined with dizziness, fatigue, or a feeling of pressure in the chest or neck. These aren't merely signs of getting older, they could indicate something more serious and treatable if addressed promptly. Another warning sign involves persistent fatigue without an apparent cause. While occasional tiredness is normal, chronic fatigue without a clear explanation might be more than just insufficient sleep or age. It could suggest that your heart is struggling to receive enough oxygen due to narrowing arteries, which often don't produce immediate symptoms. Fatigue linked to poor circulation doesn't always hit suddenly, it can gradually sneak up on you. You might find yourself waking up tired despite a good night's sleep or feeling exhausted halfway through the day. Routine tasks, like preparing meals, doing laundry, or engaging in lengthy conversations, may start feeling burdensome, not due to laziness or forgetfulness, but because your heart is exerting more effort than necessary. When arteries become clogged or constricted, your heart needs to work harder to circulate blood. This sustained exertion eventually takes a toll, and while you may not feel an immediate impact in your chest, your body responds by conserving energy in subtle ways. This leads to reduced motivation and slower movements, creating a sensation that your energy has inexplicably vanished. I recall a 74-year-old woman named Janet, who once spent hours gardening without a second thought. Recently, she found herself needing breaks just 15 minutes in, not due to being out of shape, but because she felt unwell. Blood tests and scans revealed that her heart was receiving diminished blood flow due to partial blockages. After modifying her medication and diet, she reported a dramatic improvement in her energy levels. This highlights that fatigue isn't always about feeling tired, it's often your body's way of indicating distress. When linked to blood flow, no amount of coffee or naps will improve it until the underlying issue is addressed. The insidious nature of this red flag is how inconspicuous it appears, especially as we age. People might comment, "You're just not as young as you used to be." However, aging doesn't necessarily entail feeling perennially exhausted. There's a distinction between normal slowing down and a marked loss of vitality that your heart is attempting to communicate, urging you to slow down. If you're watching this video and finding this information beneficial, leave a comment below with number 2 to let me know you're engaged. Should you not have subscribed yet, I encourage you to do so and activate notifications so you won't miss out on future content. Your support is vital for us to keep producing informative and inspiring material. Now, let's proceed to the next warning sign. Red flag 3 involves leg pain or cramping during walking, known as claudication. This lesser-known symptom of obstructed arteries manifests not in the chest, but the legs. If you've ever felt aching tightness or cramping in your calves, thighs, or hips while walking, which subsides with rest, you might be experiencing claudication, often linked to blood flow issues to the extremities. There is a chance that your arteries might be narrowing, not only in your legs but possibly close to your heart as well. Here's what unfolds as you walk. Your muscles demand more blood rich in oxygen, but if your arteries, particularly those in your legs, are partially obstructed, the supply can't keep pace. Your muscles start to function with insufficient fuel, leading to what you feel as a burning or squeezing sensation, or even heaviness. Warning sign 3 involves experiencing leg pain or cramping while walking that forces you to halt, and as soon as you rest, the blood flow balances out, and the discomfort subsides. This pattern, pain with movement and relief with rest, is a crucial indicator. What makes this symptom particularly perilous is that many dismiss it as arthritis, aging, or simply having poor leg health. However, true claudication indicates a more serious condition known as peripheral artery disease or PAD. PAD is not confined to the legs, it's a systemic issue, which means if it's present in one region of your body, it's likely affecting other areas, including the arteries near your heart and brain. I once met a man named Gerald, aged 79, who used to walk to the park every day. Recently, however, his right calf began to ache halfway there. Initially, he shrugged it off as a strained muscle until the day he couldn't get past his driveway. Subsequent tests showed significant blockages in the arteries of his legs, but more critically, his cardiologist found similar narrowing in his coronary arteries. That leg pain inadvertently led to the discovery, prompting him to take action before a more severe issue developed. Claudication can occur in either one or both legs, manifesting as pressure, fatigue, or a tightening sensation that consistently appears with activity, and crucially, disappears with rest. If this scenario sounds familiar, do not dismiss it. Your body is signaling that it isn't receiving sufficient oxygen where it's needed because something is causing blockages in your arteries. Catching it early offers more options: medications, physical activity, diet changes, and sometimes a simple procedure can significantly enhance blood flow not only in your legs but throughout your body. Leg pain isn't always about muscles or joints. Sometimes, it's your heart signaling for attention, even when the pain isn't near your chest. Warning sign 4 involves erectile dysfunction in men over 50. Many attribute changes in sexual performance to aging, stress, or hormonal fluctuations, but another frequently overlooked cause is poor circulation. In fact, difficulties in achieving or maintaining an erection can be one of the earliest warnings that your arteries are starting to narrow long before any chest pain or shortness of breath manifest. Erections rely on a robust and steady blood supply, and the blood vessels in that area are small and sensitive to changes in circulation. When plaque begins to accumulate in the arteries, these smaller vessels are often the first to be impacted. Warning sign 4 is a decrease in sexual performance. This decrease can actually be an early indicator that your cardiovascular system is not functioning optimally. It doesn't suggest every case of erectile dysfunction is linked to heart disease, but when it becomes frequent, particularly in men over 50, medical professionals often consider it a vascular alert. In numerous instances, it surfaces years before other heart disease symptoms appear, and it's not merely about sexual health, it's a matter of survival. Plaque formations often affect multiple body areas, impacting the arteries leading to the heart and brain. I knew a man named Ray, aged 68, who started experiencing erectile difficulties but kept this to himself for almost a year. During a routine checkup, he finally mentioned his issue, prompting the doctor to conduct several tests. These revealed early-stage coronary artery disease. Ray had experienced no chest pain or difficulty walking, nor any severe symptoms, but that subtle warning allowed him to make lifestyle changes and start treatment, thus avoiding a potentially imminent heart attack. This warning is commonly overlooked due to the sensitive nature of the topic. Many men feel embarrassed or attribute it to aging, ignoring that it is a critical alert from the body indicating insufficient blood flow. Erectile function is not solely a sexual concern, it signifies blood circulation issues. Disruptions in blood flow at one site often indicate similar problems elsewhere. Recognizing changes in sexual health is not about embarrassment, it's an early detection measure, a reminder that the body constantly communicates through signals, you just need to heed them. If you're still following this video and find these insights beneficial, please comment with the number 4 below to indicate your presence. Do consider subscribing and activating the notification bell to stay updated on new content. Your support enables us to bring informative and inspiring content. Now, moving on to the next warning sign. Red flag number 5, cool or pale extremities with weak pulses. The body has a straightforward method of signaling poor blood circulation, which often begins at the peripheries. If your hands or feet feel cooler than the rest of your body despite being in a warm room, or if your skin appears unusually pale or bluish, it could suggest impaired circulation. When this is combined with weak or hard-to-locate pulses in your wrists or ankles, it may indicate silently and gradually narrowing arteries. Internally, this occurs when blocked or stiff arteries prevent the heart from efficiently delivering blood to distant parts like fingers, toes, hands, and feet. These areas are akin to the farthest rooms in a building with plumbing issues, still connected but barely receiving what they need. This insufficient blood supply shows through physical symptoms. You might find your socks and shoes colder than before, your fingertips slow to warm up, or experience intermittent numbness or tingling. These aren't mere annoyances, they're signals indicating that your vascular system could be struggling and that the problem might lie along the arteries leading to these areas. I remember Martha, a 72-year-old, who noticed her right foot was persistently cold to the touch even when the rest of her body was warm. She attributed it to circulation issues from prolonged sitting or weather changes. However, during a routine checkup, her nurse struggled to find a clear pulse in that foot, leading to further examination. It was discovered that her leg's arteries were significantly narrowed, posing a risk of complete circulation loss without treatment. The real danger with this condition. Having reduced blood circulation doesn't simply cause discomfort, it can lead to more severe issues such as cold, pale limbs that may eventually escalate into conditions like tissue damage, ulcers, or in the most severe situations, the potential for amputation. It rarely makes an immediate and dramatic appearance but rather begins subtly, manifesting as chilly fingers, pale toes, or a faint pulse that's hard to detect. At home, you can perform some checks to assess this. Compare the warmth on both sides of your feet, feel for a pulse by the inner ankle or atop your foot, and check for uniform skin color. These simple observations can reveal significant insights, particularly if you observe any changes from your usual state. As circulation diminishes, it often retreats quietly, slowing down without any obvious alarm, leaving your extremities colder, which could be an indication that your heart is under more strain than you might realize. Paying attention to these subtle signs might not only enhance comfort but also provide the opportunity to intervene before a minor issue escalates into a major one. The earlier poor circulation is detected, the greater the number of options available to safeguard the health and vitality you've strived to maintain. Now, reflecting on the 5 warning signs you've just learned about, Do any of them sound familiar? Perhaps you're finding it harder to catch your breath, your legs ache during walks, or there's an unexplained fatigue that lingers. These symptoms might not seem significant on their own, but together they create an overall picture signaling that your circulation might be compromised. That's why it's crucial to listen early. Blockages within arteries don't always result in immediate, intense pain. They tend to murmur, slow you down, and subtly alter your routines. Ignoring these whispers can lead to more serious outcomes such as heart attacks, strokes, or other sudden emergencies that could have been mitigated. The positive aspect is that your body always provides another chance to take action. Every warning sign discussed is an invitation to investigate further, to seek evaluation, and to express any concerns, no matter how trivial they might seem, to a healthcare professional. Often, lives are preserved not by dramatic interventions but by recognizing and addressing small signs early on. So, if any of today's red flags resonate with you, it's essential to treat them with seriousness. While there's no need to panic, it's important to remain vigilant. You should consider checking your blood pressure, consult your doctor, and perhaps request a straightforward vascular assessment. Remember, discussions surrounding these signs are not solely aimed at disease prevention. They are about safeguarding the energy, autonomy, and independence you have spent your life cultivating. You deserve to live with ease and vitality, confident in knowing your heart and body receive continual support, not merely when issues arise but every day along your journey. Thank you for joining us today. We would love to hear from you. Please comment below and share one new insight you gained today and how you intend to apply it to your life. Your feedback is important to us, so don't hesitate to express your thoughts. Reading your comments fuels us with motivation and encouragement. If this video was helpful and enjoyable, please like, subscribe, and share. Your support enables us to keep producing quality content to inform and inspire you. Thank you for watching, and we look forward to engaging with you again.